80% of the internal referrals come from 20% of the referral sources. Could that be true? That is true. Okay, so when you're talking about internal marketing, there's a certain small percentage of the patient base that refers 80% of all the referrals. Okay, so let's talk about something else here. Let's talk about the life cycle. Let's talk about the life cycle of the patient, a patient relationship here. We have before, during, and after. So for the benefit of the newer people, if you go to page 61 in the book here, we'll go over the lifetime value of a dental patient. Okay? The lifetime value of a dental patient, as far as I'm concerned, is $45,000. Usually I have a nice slide and we roll this thing out and it's like drum roll. How much is it? It's $45,000. The potential lifetime value of a dental patient over a 20-year period is $45,000. That's because, and I'll just go through it really quick, the revenue for pro-fee exams and bite wings for 1 year, a conservative estimate is $250. And that's $1,250 over 5 years, okay? If they only had one major procedure every 5 years, just one cusp broke, they needed one root canal, they needed one implant, one major procedure for only $1,000 every 5 years, the total revenue would be $1,250, which is all of their pro-fees and bite wings and exams, plus the $1,000, that's $2,250. Multiply that by a lifetime, which I'm defining as 20 years, you're looking at a $9,000 patient, right? Okay, so if that $9,000 patient only referred one person, just one person, every 5 years, they would be worth $45,000. Are we all following that reasoning, that line of thought? Okay. So now we're all on the same page as far as the definition of the lifetime value of a patient. So let's talk about now the life cycle of a patient as it applies to the 80-20 rule, okay? So before, you have a before, during, and after phase of this patient life cycle, that 20 years that we're shooting for, okay? So if 80% of the revenue comes from 20% of the patients, and we're designing an external marketing campaign to try to attract more patients into the office, okay? Are we going to be designing that marketing piece to appeal to the stem or the actual goblet? The goblet, right? Who cares about the stem? That's the majority of your patient base, but they're giving you only 20% of your revenue. So forget them. Open up the yellow pages, open up your newspaper, and you'll see people that are advertising $299 crowns, $299 dentures, $59 extractions. Those people are trying to appeal to the stem, okay? The way that we want to design our external marketing campaigns is to appeal to the actual glass portion, the 80%. Forget about the 80%. We want to appeal to the 20%. That's going to give us the most return. Okay? So, along those lines, what a good idea to do is, first of all, figure out who that 20% is. Okay? So say you have a patient base of 2,000. What's 20% of 2,000? 400. So you have 400 patients that are giving you 80% of your revenue. Okay? That's the sweet spot. Those are the people that we need to be paying attention to. Okay? So a good idea would be to figure out exactly who those 400 people were. I mean, like literally get names and figure out what the commonalities are among those 400 people. Okay? When we figure out what the commonalities are, is there a gender commonality? Is there a socioeconomic commonality? All right? Do they make a certain amount of money? Do they live in certain neighborhoods? You got to be very, very specific about who that 400 people is and treat them really, really well. If that means birthday cards, Christmas cards. We have this thing where, we have 2,500 active patients per 2 practices. That's 5,000 Christmas cards. So we just don't do it. But what would be doable is maybe 500 of our top producers in one practice, send them a Christmas card, or maybe even a little Christmas present. Same thing for the other practice, 500. Okay, that's a lot more doable. You want to figure out exactly what these people look like, and you want to develop a composite. We talk about the avatar. The avatar is the ideal patient. Okay? The 400 is our avatar. That's who we want to appeal to in our marketing. We should have a very, very clear idea of who that avatar is. In our office, it's Sally. She's a 65 to 75-year-old female, empty nester, gets her hair and nails done. She goes to Curves or some other gym. She likes to go to certain places to eat. Okay? She makes a certain amount of money, or she's retired. Very, very specific. And then when we are sitting down to design that external marketing piece, and Aaron's going to talk about some really, really exciting stuff after lunch, and direct marketing, direct mail. When we're sitting down to design our direct mail piece or our print ad, or we're designing any type of external marketing campaign, we're going to have Sally in mind. Okay? So the before in the life cycle is, first of all, doing an 80-20 analysis on your existing patient base. Okay? Figuring out exactly what those 400 look like and design your marketing campaign to attract more Sallys and less of the 80%. Okay? So that's all theory right now. We're going to get down to specifics a little bit later as far as how we're going to design that and how we're going to pull that off. The during phase, this is our UPE. So thinking about the $45,000 lifetime value of this patient, we need to be remembering, and you guys have all heard this, that we have to control every aspect of every moment that they're in contact with our office. Whether or not they're in the physical facility, preparing to come into the physical facility, and after they've left the physical facility, that's part of the patient experience. We have 8 specific steps. Does anybody know them all? Anybody know any of them? What's the first step of the ultimate patient experience? Initial phone call?
Okay.
Initial phone call. Okay? The next one is confirmation call, and I'll go over this more slowly and give you guys some paperwork to back this up. But initial phone call, confirmation call. Patient arrives at the office and is greeted by the front. Okay? Transition from reception area to treatment room. Okay? Introduction to doctor. Transition out. Okay? So that's how the 8 steps go. I just did that really quick. I probably missed one. But anyway, there has to be a very, very specific way that we handle each one of these steps. Okay? And when we talk about this stuff, it all sounds like a really good idea, and people nod, and yes, I'm going to go home and do that, and we're going to come up with our script as far as how we answer the phone. And this is how, just like Mark says, we're going to greet each patient from the waiting room and shake their hand, look in their eyes, walk side by side into the treatment room. We're going to seat them in the treatment room. We're going to ask 3 rapport-building questions before we say anything about dentistry. We're going to explain the treatment procedure. We're going to start the treatment procedure. The doctor's going to walk in. We're going to introduce the doctor. The doctor's going to ask 3 rapport-building questions. All that stuff, it sounds really good, right? It's in a manual. I gave it to all of you guys. And you new people, you're going to get that too. But what happens? There's no accountability, right?